hundreds of thousands of lives lost. It's truly staggering, but there are signs of progress in the fight against COVID-19 in the United States. Pharmaceutical giant Merck has developed an antiviral pill to fight COVID-19. Clinical trials show it reduced the risk of hospitalization and death by nearly half. Merck will apply for emergency use authorization in the U.S. as soon as possible. This would be the first antiviral pill for COVID-19.
The news of the efficacy of this particular antiviral is obviously very good news. The company, when they briefed us last night, had mentioned that they will be submitting their data to the FDA imminently. The data are impressive.
The federal government has contracted to buy 1.7 million doses if the new pill is granted authorization. But the White House emphasizes that vaccines are still the most effective tool in the fight against this pandemic. There are some indications that controversial vaccine mandates are working. New York State put a mandate in place for healthcare workers, and the vaccination rate among those workers went from 84% to 87% in just a week. The private sector is seeing similar results. United Airlines put mandates in place, and now 99% of its workforce is vaccinated. The airline has begun firing the holdouts. The White House is also encouraging pregnant women to become vaccinated. They point to data showing the jabs to be safe for mother and child. Meantime, Supreme Court Justice Brett Kavanaugh has tested positive for COVID-19. He was vaccinated back in January. The court says he has no symptoms at this point. The Supreme Court is scheduled to hold hearings on Monday. It's not clear how they will proceed. There are some encouraging signs that the Delta variant-driven wave that we're in now may have peaked. For about 2 weeks now, we've seen new cases decline, and now we're seeing hospitalizations and deaths fall as well. But experts warn that as the U.S. enters the winter months, cases could rise again. Jim Spellman, CGTN, Washington.